Hello, everyone, and welcome to another episode of Coffee with Cade. My name is Candace Oakley, and I am the Executive Assistant to Dr. Camille Hammond at the Cade Foundation. Today's topic is, why can't I carry a baby? Is something wrong with me? What's wrong with me? To help me talk more on this topic, I have Dr. Deborah Wachs from the
Hello.
Reproductive Science Center of the San Francisco Bay Area. Hi, Dr. Deborah. How you doing?
I'm doing great. How are you?
Good. I'm doing well. Can you tell us about yourself?
Yes, I'm one of the partner physicians at Reproductive Science Center. We have 4 offices in the Bay Area and treat lots of patients who are trying to have children.
Awesome. Thank you so much for joining.
Ready. Bring it
Okay.
on.
So, what are some of the key causes of miscarriages?
So that is a group of patients that we will see, patients who are able to get pregnant but keep having miscarriages. Some of the key causes are chromosome problems in the embryo itself. Sometimes it can be an issue with a woman's uterus. Sometimes there can be some factors in her system that can be too high or too low. That can also lead to miscarriage. Those are some of the key causes.
Oh, wow. Okay, that's really good to know because a lot of times I know a lot of physicians say, "Oh, it happens, it's normal, it happens to so many people," but that's really good information to know.
I was going to say it does happen commonly, and sometimes there isn't an identifiable reason, but sometimes there is.
Yeah. Okay, great. So what are the top diagnoses that keep women from carrying a baby full term?
So, in our practice, we generally follow patients through 9 weeks. And so, if a woman isn't going to be able to carry while she's with us, it tends to be the miscarriage category. But then we graduate our patients at 9 weeks, and then they go back to their OBGYN doctor who continues to follow them. So, if they are unable to carry beyond that point, sometimes they can have preterm labor.
Mm-hmm.
Sometimes they can have something called an incompetent cervix, where their cervix
Mm,
dilates too early. Then
yeah.
there are some later miscarriages that can happen beyond 9 weeks as well.
Oh, wow. Okay. Yeah, that's okay. That's good, information to have people, because there's different stages that have miscarriages. So, a lot of people don't know that. So that's good information. Okay. So what are some of the frequent myths you hear about miscarriages or stopping miscarriages?
I would say number one is if I just lie in bed and don't do anything, I won't have
Yeah.
a miscarriage. So I think the main myth is women inherently blame themselves if it
Yeah.
happens. And so when they get pregnant the next time, they think if I just lie in bed and I
Yeah.
don't do too much activity, I'll prevent the miscarriage. And that is definitely a big myth.
Yeah. I've heard about that too. Yeah. I guess people get so nervous as well, and they're like, "Oh, I can't do too much for the baby," and especially if you work out and stuff like that.
Yeah.
So, yeah.
Also, I think it's human nature to think about what was going on when it happened the last time. So
Yeah.
we'll have patients who ate a certain food and they'll never eat that food again because they
Okay.
think that's when they miscarried, or they were more active that day. And so I think women will tend to associate whatever happened the day they miscarried with
Okay.
why.
Yeah. That's okay. That's good information. Good. Okay, so if I know I cannot carry a baby, is a gestational carrier my only option?
Well, I guess that depends who your partner is. If you have a female partner, then maybe she can carry the pregnancy.
Okay.
And we'll certainly have couples where one partner will be able to use her eggs to have embryos and the other partner will carry the pregnancy.
Okay.
Um, but if you have a male partner, then as of now, technically he cannot carry. So then, yes, using a surrogate would likely be your best
Yeah,
option.
yeah. Yeah. Okay. So what are the important tips when considering a gestational carrier?
So I think the most important tip would be the selection of the woman who's going to be the carrier. We will work with couples who want to or need to use a gestational carrier, and we help with
Yeah.
that screening process.
Okay.
And sometimes there will be a candidate who she herself had a complication in pregnancy. She either delivered early or she had hypertension or diabetes or some other issue in pregnancy. So I think the number one thing is you want to work with a surrogate who pregnancy for her was super easy, straightforward. She had term deliveries, no complications, because
Yeah,
that's the person who presents your pregnancy with the lowest risks.
got
And
it.
we will work really hard to get all of the medical records and all of the details about the prior pregnancies, because in order for someone to be considered as a surrogate, they need to have at least one successful full-term pregnancy, and it's better if
Oh,
more.
really? Okay.
Yeah,
So if if the potential surrogate never, conceived at all, okay, so it's an extensive check
right.
before you. Okay.
Exactly. Someone may say, my best friend says she'll do it for me, but if she's never been pregnant, that doesn't help you. So
Oh, wow.
one of the requirements is at least one term delivery, and ideally you even have more than one that shows that she's been able to successfully be pregnant. You want to think about the age of the surrogate as well. So we're pretty generous. She can be in her 20s, she can be in her 30s, she even could be very, very early 40s, but ideally I'd say 20s to 30s is the best age for a potential surrogate. And then she herself should not have any medical issues, which can also be worse in pregnancy or can complicate a pregnancy.
Got it. Got it. Okay. That breaks it down and kind of gives people a good idea of who could be potential carriers. So that's good. That's good information.
Yes.
Yeah. So, this is Coffee with Cade. Oh yeah. So is family preferred over others? Like would you say friends over family or family over friends?
So I think there's pros and cons to working with a family member or a friend or working through an agency. So working with a family member or a friend financially is going to be less expensive than going through an agency. But there are, of course, risks with pregnancy. And so when you're going to potentially work with a friend or a family member, that's
Yeah.
something you need to make sure the relationship feels comfortable with.
Yeah.
Working with an agency, the agency helps with a lot of the legal process and the screening process, but it is more expensive to work through an agency. And so we'll have both. We have patients who have a sister or a friend who's a great candidate, and then
Yeah.
we have patients who either don't have that in their life or like the veil of working through an agency in helping
Okay.
with the selection process.
Awesome. Okay. And those are good points because, recognizing that there is a huge financial piece to this. And then
Yeah,
also, if you have a friend or a family, you got to think about that relationship. If anything were to happen, is their relationship strong enough to withstand that? So that's a good point.
absolutely.
Yeah.
Absolutely. And the financial part is a very big piece to whether um, a patient can in fact pursue that option. And there are
Yeah.
times where it's financially not an option, and we try to work really hard to figure out what can we do to help a patient be able to carry on her own.
Yeah. 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 Okay. And also, best overall practices, um, to prepare for pregnancy after miscarriage.
So if a woman has had a miscarriage and we're working with her, we do all of the testing to try to figure out, was there an identifiable cause for her previous miscarriage, and if we do find that, then that is easier for us because we can address it and then move forward. But
Yeah.
about 50% of the time, we don't find a reason for a miscarriage. And so in that subset of patients, We work overall looking at lifestyle factors and anything else that's present that could be presenting an increased risk for miscarriage. So things like, is she at her ideal weight? Are there any, is she smoking cigarettes? Is she drinking a lot of alcohol? Is she on any medications that increase risk for miscarriage? Same true for a male partner. We will do the same deep dive, figure out, is there any exposures in his life or any sperm factor which would increase risk for miscarriage? So best practices after a miscarriage going into the next pregnancy is to make sure you've done the testing, which can help you figure out why you had the miscarriage, and then overall maximize lifestyle factors
Yeah.
so that you go into the pregnancy as healthy as possible.
Okay, okay. And so lifestyle, behaviors is a huge piece of this too.
Yeah.
Okay. And so you said there is a test you can take after to determine why miscarriage, did you say?
So yes, we will evaluate the uterus. Sometimes there can be
Oh,
an anatomic reason for a miscarriage, and we can fix
mm.
that. Then sometimes we'll find a thyroid problem or a blood clotting problem, and those can be addressed going into the next pregnancy.
Wow, okay. So there's a lot of moving pieces to it. So the moral of the story is to get seen by someone to get an idea of where to go, your next direction to go.
Yes, and as you referenced earlier, if a woman has had one miscarriage, it doesn't necessarily mean that she's got an issue that will cause her to have another.
Yeah.
We believe 15 to 20% of all pregnancies are miscarriages ultimately. And
Oh,
so it's not uncommon for a woman to have a miscarriage. So I caution my patients that if they've had one miscarriage, they don't have to fear that they're never going to be able to become pregnant. But if
okay.
a patient comes to see us because they've already had 2 or 3 miscarriages, it is important to do the testing and figure out
Yeah.
if there's a reason that we can identify and prevent a future miscarriage.
Gotcha. Gotcha. That's a good point, and reaffirming to those who have just had one miscarriage and had multiple, so that breaks it down for them.
Yes,
Yeah. Well, thank you so much for coming on, Dr. Wachs. It
you're
was
welcome.
a great conversation, and this is Coffee with Cade. So, are you drinking anything
I
today?
I am. So this is my daily coffee.
Okay.
I take a lot of cream and a little bit of coffee. So my blend is coffee, and my husband is from Pittsburgh, so I have married into a
Okay.
Steelers fan. So here's my Steelers mug. This is my daily blend.
Oh, okay. Nice. I have my ginger tea. Try to be a
Ah,
little
that's
healthy.
yes, yes.
Well, you shared a lot of information. So how can the viewers contact you or learn more about, your knowledge?
So we have new patient appointments daily at our practice, and I'm one of 7 physicians in our group, and we are always excited and happy to see new patients who are either having trouble getting pregnant in the first place, having miscarriages, or want to preserve their fertility for the future. So those are the 3 main categories of patients that we see, and we would love to see any of your viewers and help them out.
Yeah, yeah. Awesome, awesome. Well, I can't forget, we are having our Course with Cade in Livermore, California, August 28th, 2021. And the Reproductive Science Center, which you are a part of, will be the presenting sponsor. So we're super excited. And we're looking forward to seeing you there. So once again, thank you so much for
Yes, I'll
joining
be
us
there with
today.
my partners and many of them.
Yes, yes.
Thank you.
Thank you.
Thank you so much.
Yeah.